Los Originales Community Health Worker Radio.
Welcome. Hello, everyone. We are here on Los Originales CHW Radio. Today, we have a very special guest. We'll be talking about COVID-19 vaccine myths. This is part of a series. So this is the second of 3. We really want to make sure that people have all the right information about vaccines and how they work, and maybe some of what they're seeing or hearing is not quite accurate, and we might want to have some better information to have better discussions. So we have a very special guest. Dr. Anna Wald will be here speaking with us. She is a professor at the University of Washington. She is a medical doctor and also in the epidemiology department at UW, which makes me very excited. I am so excited to have an epidemiologist, someone who works in that field, speaking with us today. And first, we want to remind you, speaking of the vaccine, very important stuff, go get vaccinated. You can get vaccinated with a free ride from Uber, thanks to Community Health Worker Coalition for Migrants and Refugees. All you have to do is call or text one of these numbers. So Jacqueline speaks both Spanish and English, so you can call or text her at 206-291-2599 if you need or want a free ride to your vaccine site and also back home. So you will be completely covered. We'll keep announcing this. Make sure you get this number written down. Make sure you share this information. Other people may need a ride, so keep it up. Make sure you get vaccinated. There are lots of benefits, which we'll be talking about throughout the show. So stay tuned. And now I want to go ahead and introduce our wonderful special guest. Thank you so much for being here. We have Dr. Anna Wald. Hello.
Hello. Thank you so much for inviting me.
Thank you for coming. I really appreciate it. So first, I would love to hear a little bit more about who you are and what you do.
Sure. So first of all, my apologies that my Spanish is not good enough to do this in Spanish. I'm hoping that people will understand, and I'll try to speak slowly for people who may have trouble with English. So I'm a physician. I take care of patients. I'm a specialist in infectious diseases, and I'm also an epidemiologist. Now, what is an epidemiologist? Epidemiologist is a person who's not only concerned with the health of an individual person, but also with the health of a community. So to give you an example, important public health, so coming from epidemiology, interventions are seatbelt use, right? So the fact that people are supposed to wear seatbelts is a public health intervention. It reduces people dying in the car accidents. Another public health intervention is the fact that in this country, you can turn on your tap and you can drink the water from the tap. That's not true about many other countries, right, where the water is not safe to drink. So these are public health interventions that have been done by people who are epidemiologists who decided that this is a way to improve health, not just of an individual, but of the entire population.
That's a really good definition and a way to explain it to folks who maybe have never heard this before. So I like to think about how much people in public health or in epidemiology or both, nobody heard of their job before the pandemic. Nobody knew what they were. When I studied public health in school, so many people responded with, "What's that?" when they would ask me what I'm studying. And I would say, "I'm studying public health." And they would say, "What's that?" And if I said I was studying epidemiology, I'm sure I would have gotten the same response from a lot of folks. So how do we think that kind of this lack of information or understanding about what epidemiology is maybe has led to some of this distrust that people have when they're learning about COVID-19 and hearing about this virus for the first time?
I'm not sure exactly. I think it's important to remember that the word epidemiology is related to the word epidemics, right? And an epidemic is sort of an unusual amount of disease or infection in a population. So we're having an epidemic right now. And I think that's one of the reasons that the word suddenly became a lot more frequently heard than before. But I think big words in general are intimidating, right? And we have to sort of learn about it. And public health, historically, it's a mixed bag in the way that it has dealt with communities. There are certainly aspects of public health that have worked closely with communities to gain their trust, but there are also aspects of public health that have not done that and that have worked with the government. And certainly depending on which administration we're under, there are lots of reasons why people don't trust what comes out of the government.
Mhm. That's a really good point, that the way that public health is done is varied, just like the government is varied, right? There's, there isn't just one like body that is the government, and there's not one body that is all of public health, and that there are ways to work with and in and be of and from the communities in ways that build more trust and more acceptance, which is part of what we do here at Community Health Worker Coalition for Migrants and Refugees. We work with community health workers, also called trusted messengers. That is something that is used to refer to folks who are from the communities that they're working in and have a close relationships with people that make delivering this kind of information more readily accepted, or just opening up conversations rather than people being told what to do, which sometimes has a backlash. And I wanted to go ahead and point out some benefits of getting vaccinated. We need to keep reinforcing this all the way as we go, as we're having these conversations. Folks do want to get vaccinated because it's going to reduce the risk of serious disease if you were to catch the virus. So, maybe going to the intensive care unit with COVID-19, that won't happen to you, or getting very seriously ill. Death also, if you get the virus, the risk of actually dying from the virus, it will plummet, and having these long-term health effects also will plummet. So it's a life-saving activity, and it allows you to be more careful and safe when you're around other people who you love, that you want to spend time with. You can kind of start getting a little bit more back to spending time with people if you go ahead and get vaccinated while still being safe. So highly recommend doing that. Thank you for telling us a little bit more about epidemiology. As I said, I don't think many people had heard of it. But all that said, the distrust, let's get into some myths. Okay, we're here to talk about some myths, so let's get into it. The first one that we have is getting vaccinated doesn't matter because you still have to mask and distance in public anyway. What do you have to say to folks who kind of feel this way about it?
So I don't think that's quite right. We have actually stopped masking outdoors. So I think that's a big change. But one way to think about it is sort of the Swiss cheese analogy. Mm-hmm. So, Swiss cheese has holes, but the holes in each slice are in a different place, right? So you're trying to prevent the virus from getting to your body in lots of different ways. So masks are one way, staying away from each other are a different way, but it actually turns out that vaccines are probably the most effective way. So yes, you can do those other things to further reduce the risk, but it's pretty clear that the vaccines are the most effective approach to reducing your risk of getting COVID.
Right. Yeah, absolutely. I think that's for folks who haven't heard the Swiss cheese analogy before, it's an important one. So if you picture, little slices of cheese with lots of little holes in them, they're not all in the same place. So when you line it up, eventually the virus gets stopped somewhere. So if you're taking these multiple approaches like masking and distancing, staying away from folks, physically distancing from people that you don't know, but also maybe staying home a lot more, and even distancing from family, or taking all of these different approaches, eventually they're all going to work in combination with each other. And the vaccine is, it's worth many slices of cheese because it just really stops a lot of the transmission, and it stops a lot of the serious illness and death from the disease. So it's very important that folks go get vaccinated. We have Dr. Ileana Ponce here with us. She is the executive director of the coalition, always here supporting us. She says, bienvenida, Dr. Wald. She says, welcome to you. Thank you so much for being here. Kirsten says, so glad to learn from y'all. Thanks for doing this. Yeah, thank you for being here. I appreciate it. And I appreciate Dr. Wald being here. Trusted messengers, what a great term. Kim, yes, it is a good term because it's pretty accurate. That's really what their job is and what's going on there. So definitely recommend incorporating more use of community health workers in any sort of program. All right, let's get to myth number 2. The pandemic is over. Is it over, Dr. Wald?
Well, unfortunately, I think the latest numbers suggest that it's not over because the numbers have been going up very sharply during July. I think this has been fueled by a couple things. One of them is that a lot of places have relaxed their mask and distancing guidelines. So that's one reason. Another reason, I think, at least locally here, it looks like July 4th, people had a great weekend and got together with lots of friends and family, and we saw the rates go up after that. But the third reason, which is probably the most important, is that the new variant, the Delta variant, seems very infectious, more infectious than the others. And in fact, it has been described that even on very casual contact, which we don't often think as leading to transmission, this variant, you might be able to transmit it. So it's very concerning in that way.
Right. What do folks need to know about the Delta variant and the vaccine? Does the vaccine help with transmission of the Delta variant?
We don't know if it helps with transmitting it. So we know it helps you from getting COVID and from getting sick with COVID and from being in the hospital with COVID and dying with COVID, right? And I think to what extent it also stops the spread of COVID, the vaccine, that is less clear. And unfortunately, it looks like it might be a little bit less effective for stopping the spread of COVID than it is for the other variants. But it definitely prevents people from going to the hospital, being very sick, and dying with COVID.
Yes. Yeah, 100%. So you want to get vaccinated so that you're reducing the risk of something really serious happening to you, because the virus is mutating. It's becoming, better at getting around, and that's what we have with Delta here. It's getting better at getting around, being more virulent. Okay, myth number 3: the COVID-19 vaccine affects menstruation, pregnancy, fertility, and the placenta. This is a big one. A lot of folks are very concerned about this. Do you have anything to let people like that know?
That's a really interesting myth. And I think it sort of goes back to the fact that in the United States, as well as in many other countries, that have been attempts over many decades to control population growth, to control reproductive rights of women. And it is not uncommon when the myths about vaccines come up that they are about pregnancy and fertility and the placenta. So, for example, tetanus vaccine, which is really important for people who work in the fields. I hope everybody has been vaccinated against tetanus. It also turns out it's really important, tetanus vaccine, for women who are pregnant in places like sub-Saharan Africa, because the baby can get tetanus after birth. So it's really important to vaccinate pregnant women. And there were a lot of myths, for example, in a place like Kenya, that the tetanus vaccine will make you infertile. So that kind of trope that vaccines will do something to your fertility is not uncommon. So I'm not that surprised that it came up in the context of COVID, but there's absolutely no truth to it. There would be no way that a vaccine could affect fertility or placenta or pregnancy. And in fact, in the COVID vaccine trials, women got pregnant all the time, right? So when we looked at the large studies of the vaccine, women are not supposed to get pregnant while they're getting their vaccination, but that after about 2 months after the second shot, that was relaxed. And people got pregnant equally in both groups, and the outcomes of those pregnancies have been normal. Mm-hmm. So there's absolutely no reason to think that this vaccine would affect fertility or pregnancy. And in fact, we have very good data to the contrary.
Mm-hmm. I think you bring up a good point that this is a trope. So it's a pattern. It's a pattern that we're seeing in anti-vaccine myths. And I think part of it also, you mentioned that there is this concern that, the government is controlling women's bodies and their ability to have babies. And this I think also it strikes at the heart of fear in a lot of people. Like there's so much fear and so much emotion around having a family and what your plans were for having a family. And it's just really, really like plucks that string for people. Like it makes people very fearful. And so if you wanted to, if you wanted to get people to not do something, you can tell them that, and they're going to shy away from it or question it or be hesitant. So what we call vaccine hesitancy. So this kind of unwillingness to just kind of jump in and do it. What's getting people to slow down and stop and maybe not do it at all. So yeah, I think you're right. It definitely has been a trope in anything that people are trying to dissuade people from doing. Let's see. Myth number 4. The coronavirus doesn't survive when it's really hot or really cold outside. So you kind of hear both of them about whether it's hot or cold. What do we know about this?
Well, it's a respiratory virus, right? So we know that respiratory viruses persist in populations regardless of the weather. And this virus, from that point of view, is not different than other respiratory viruses. So, I think it is true. It doesn't persist in the environment, right? Whether it's hot or cold, or if the temperature is just right. It doesn't just hang out. If you go out there and you're by yourself, you're not going to get coronavirus just from the air or from a field or from a park bench, right? Or from your mail. I think a lot of the early efforts in coronavirus were really focused on sort of cleaning objects and cleaning. Yes. And I think those were really misplaced. The virus doesn't really care that much about the environment. It cares about the person you're next to, and can it jump from you, if you're infected, to the person next to you.
Right. And the virus is living, not, like you said, on your mail, it's living in your lungs, it's living in your body, which is not completely affected by the weather outside. So, something totally different to think about. I mean, it has nothing to do with what's outside. And I do think that there was a lot of, I think that's another thing that led to some mistrust were these this bad advice that came out really early on about focusing on washing your hands and not touching your face and wiping down your mail and wiping down your groceries, but, being told not to wear masks and not being told that people really need to stay very far away from each other, and not really understanding that it was carried in aerosols either. So there was a lot of bad information early on, and I think that definitely carried through.
So I think hand washing is still really important, because if you touch a doorknob that somebody with infection who just wiped their nose, right, touched, then you can touch your own eyes and inoculate the virus. But things like coming in the mail or Amazon packages, I mean, that's really not the way respiratory viruses work.
Yeah, very true. Yeah. And then the early focus was like, just do that. Just keep washing your hands and don't touch your face, and wash your hands and we'll be fine. And that was very much the early messaging, which is not quite correct. It's part of it, but not the whole situation by any stretch of the imagination. Okay. Myth number 5, if you've had COVID-19, you don't need to get vaccinated. So this is the kind of natural immunity argument.
So I think natural immunity is protective, but it's not quite as protective as the vaccine. There's really nice data showing that the immune response you get after the vaccine is much higher than you get after natural infection. And in fact, we followed about 350 people after natural infection. And some of them who've had mild disease, they don't have any immune response. So you don't even know that they're infected. And there have been cases of people getting a second episode and doing very poorly, so dying of the second episode of COVID-19. So I think it's very reasonable to also be vaccinated, even if you've had COVID. You can think about it as sort of having additional protection. There's some data suggesting that if you've had COVID and you have the vaccine, your side effects of the vaccine may be a little worse. And there's also some data that you may not need 2 shots, but thus far, 2 shots are still recommended, even for people that have had COVID-19.
Right. Yeah. Thank you for telling us a little bit more about, what does happen when you've already you've gotten it before? What can people kind of maybe think about expecting or not expect? So they can't rely on that altogether, because we're definitely not seeing full coverage that way, not nearly as much coverage as you're going to get for a vaccine. So that's a huge benefit. Absolutely. Myth 6, you can protect yourself from COVID-19 through exercise, nutrition, and vitamins. What do folks who kind of take this approach, what more information do they need?
Well, I certainly wish that was true, although I would probably fail, and certainly on the exercise part of it. And unfortunately, our immune system is pretty complicated, and it's just not enough to just eat good food, which is important, get exercise. And vitamins do not play if you eat good food and a very wide variety of foods. Vitamins usually do not play a huge role in preventing infections. And you can, see that even people who've been healthy prior and who have had good food and exercise and take vitamins, they still have gotten COVID. So I don't think the vaccine the virus really cares about that. Now, I think if you're in good shape, it might be that you'll recover faster, right? If you survive, and most people, of course, do survive, but it doesn't protect you from getting the infection.
I think I like the takeaway that it's more complicated than that. Right? So there's more going on, right? So it is good to take care of yourself and make sure that you don't have any vitamin deficiencies, and that you're eating well, and that you're getting activity, and those things are all very important for your body and for your well-being, and that might play a role. But also we have seen that there are folks who would be considered to be in very good shape, and they're still, they can still have a problem with this. And so the best source of protection is going to be a vaccine, because it's more complicated than that. It's more complicated than just being in good shape, right?
Yes.
Mm-hmm. Definitely. Good takeaway from that. Myth 7, if you have ever had an allergic reaction, you should not get the COVID-19 vaccine.
So allergies in the general population are very common, but they're incredibly rare to vaccines. So it is possible to have an allergic reaction to this vaccine. There have been a handful of people like that have been described. And in fact, even for those people, even if you have a reaction to the first one, we still recommend in most cases that you get the second one. We just take additional precautions to make sure that you tolerate it well. So having an allergic reaction to other drugs, or to just environment, or to foods is definitely not a reason not to get the COVID vaccine.
Mm-hmm. Okay. Great. That's good information for folks who have that concern. Definitely good to just kind of if you have a concern, just kind of look into it, or ask someone and get some clarification. It might help you feel a bit more confident about going forward. So thank you for helping folks out with that, Dr. Wald.
I think the one thing I would add is that if you have a concern, would be to tell the person that's going to vaccinate you, because they can do additional things to make sure that you don't have a reaction, and they will watch you for longer after giving you the vaccine, to make sure that you are under care in case there is a reaction, which is incredibly rare.
Yeah, that's great. Yeah. So just kind of speak up and let people know that you're concerned about it, and let them kind of do some additional care for you and make sure that you're okay. And that's always good to talk to your providers about any of concerns that you're having. So Veronica Diaz-Cruz is here with us. Hello, Veronica. She says, good morning. It's nice to see you. Thanks for being here. Community Health Worker Coalition for Migrants and Refugees, our Executive Director, Dr. Ileana Ponce, she says, in your experience, why do you think that the misinformation of COVID-19 vaccine is easier to spread than the truth about it? So kind of getting at the heart of how misinformation and disinformation works, why does that go around so fast? But then, there's this work kind of going uphill of what we're doing now, how to spread the truth about it. Why is that so much harder?
I don't know. This is definitely not my area of expertise. Why do myths spread? But they do tend to spread like wildfire. I think there is something very attractive about something, fantastic and an easy answer to something, right? And truth is usually more complicated. So it takes longer to explain, and myths tend to just sort of flourish, right? Very rapidly.
Yes, I think there's some sensationalism to it,
Mhm.
like we were talking about with fertility, the folks that are really concerned about fertility. Um, like we said, it's like striking at this chord, this fear that people have that's very visceral and very important to them. And then the truth about it is like Dr. Wald is saying, it's more complicated and you kind of have to learn more information. You might have to, talk to somebody who knows more and you might not have access to that, which is why we have this radio station here on Los Regionales CHW Radio, is to give people this more complicated information, give people more access to good information that maybe is a little bit more complicated and not as sensational or exciting or interesting or chord striking as a myth might be, because they definitely are meant to be more sensational. That's very true. All right, let's see. We had allergic reactions. So thank you for letting us know about that. Remember, when you go get vaccinated, if you have a concern about this, let the person who's vaccinating you know what your concern is so that they can help you out. Myth number 8, the COVID-19 vaccine is made of fetal cells. Again, we have this kind of fertility, birth theme coming up. What do folks need to know about this?
The vaccine is definitely not made of fetal cells. Now, the reason I think this myth came up is because in order to grow viruses in the laboratory, these are human viruses that infect us, you need human cells. And historically, it has been noted that some viruses, not necessarily coronavirus, grow especially well in fetal cells. The other issue with fetal cells is that you can actually keep them alive for a very long time because they keep dividing. Mm-hmm. So the most famous vaccine, for example, that's made from viruses that were grown on fetal cells is the rubella vaccine. And the reason it grows so well in fetal cells is because rubella was actually a very common reason for women to lose their baby. Because if you get an infection with rubella during pregnancy, there's a very high chance of miscarriage because the virus will infect the fetus. So I think that's sort of where the myth began. And some of those lines of cells that were started in the 60s are still in use now for a variety of vaccines, not for COVID vaccines, however, especially the mRNA vaccines. That's just not the ways they're made. They're made with modern technology, which does not rely, and certainly none of them rely on getting new fetal tissue, new fetal cells. It's sort of a historical leftover from the way the vaccines were initially made in the 50s. So that's where the myth comes from, and it does not reflect the reality.
So there was a little seed of truth, but not right, but ultimately not right, like not current, not correct, not accurate for what's happening right now. Yeah, absolutely. And I think that's another way that myths can spread, is like there's this little seed of something that might be true, or like something that's just like there's a little bit of maybe not truth to it, but there's like a history there, or there is something that can be misconstrued when people are making analogies or things like that, and they can whip up these things. It seems like they're out of whole cloth, but they have a little process for getting to there. So finding out that history was very helpful. Thank you, Doctor. Myth 9, only the elderly and people with pre-existing conditions should worry about getting vaccinated. So this kind of goes back to everything that we've been dealing with COVID-19, the whole way through, about getting ill and folks thinking that it only affects older populations and people with pre-existing conditions. What do folks need to know?
Well, the last person I know here that died of COVID was a young man in his early 30s, father of 2, right? No pre-existing conditions. So that's just not true. And that those are the only people. More than 300 children have died of COVID in this country, which is more than die of influenza every year. And we vaccinate for influenza, right? Including children, because of what we perceive as a high death rate. So I think any death is really unacceptable, even if it's rare. So that's one issue. The other issue is that it's not just about you. So even though you might be a healthy 20-some-year-old who probably will do just fine with COVID, you might give it to your grandmother, right? Or you might give it to your aunt who is on some sort of immunosuppressive therapy and can't really mount a good immune response to the vaccine. So I think those two issues is that the risk is still there, even if you don't have pre-existing conditions and if you're young. And the risk of you transmitting it to other people is also still there.
100%. So it's not just about you. That's a good takeaway. It's not just about you. So even though it's not true that you have to be elderly with a pre-existing condition to be affected by this, that's not true. Then also you need to take into consideration that there are other people and we're trying to stop the transmission and also stop all the morphing. So the fact that it's being allowed to proliferate, coronavirus is out there proliferating, this is allowing for the mutation, which is allowing it to be even, now we have the Delta variant, which is more concerning. So stopping the virus and playing your part to stop the virus for yourself and for other people, because it's not just about you, is really important to remember, and why everybody needs to go take care of it. Just go get a vaccine.
I think you made a really important point that the variants actually arise if there are lots of people that are not vaccinated. So one of the other important reasons to get vaccinated is to stop the new variants. And one of the myths that you don't have on the list is actually that the vaccines cause the variants. I have heard that as well.
Wow.
Yeah. And that's actually the opposite is true.
Wow. I have not heard that the vaccine, I have not heard people saying that the vaccine causes the variants.
Yes.
That's a big one. Wow. So we have the opposite there. The opposite is true. So that is just a complete lie and very backwards. It's a backwards situation. All right. We mentioned the flu and children getting vaccinated from the flu because of the high death rate. So this myth is the flu vaccine protects you from COVID-19. I'm not sure where this came from or why folks are saying that, but why would that not be true?
There's no reason for it to be true. I mean, first of all, the flu vaccine is not a very good vaccine. I think we just have to be honest about it. It's only 50% effective. The COVID vaccines are 95% effective. That's a huge difference in my mind. So the flu vaccine, which is made to protect you against flu, doesn't even do a great job of protecting you from the flu. It does a decent job of preventing you from being hospitalized or dying from the flu, which is, of course, really important. But there's no reason to think that it would protect you against a different virus. Right? Vaccines are very specific for a given bug, for a given bacteria or a given virus. They don't confer protection sort of broadly against other viruses.
Yeah, that's exactly right. Dr. Ileana Ponce says, thank you, Dr. Wald, for providing this valuable truth about COVID-19. Yes, thank you so much for being here. I really do appreciate getting some good information out for people. It's so important. And it is interesting that folks would think that a vaccine for one virus would work for, like any virus or just another virus. That's really not how it works. So this is, virus specific. And that would be why you would have, a kind of a variety of vaccines throughout your lifetime, which is kind of one of the things that some anti-vax folks don't like about vaccines is, there's the image of a baby getting, 20 needle jabs at a time. But the reason that folks have multiple different vaccinations over the course of a lifetime is because it's not for all viruses, it's for a virus.
I have to say, I still remember bringing in my infants in and, them getting 4 shots at one visit. So it's a lot that we give. But you also have to think about the fact that in daily life, babies encounter thousands and hundreds of thousands viruses and bacteria, right, that their immune system needs to make a response to. And they also make a great response to all of those vaccines, even if they're getting them all at the same time.
Yes, it is very good to remember. Yeah, thank you. Let's see. We have here myth number 11. This is our last myth that we have on the list today. There's so many of them. It's amazing. And that's why we have a series. There's just so many of them. So this one is the COVID-19 vaccine causes you to get COVID-19. What do folks need to know about this?
So I think it's important to understand how the COVID vaccine is made. So the virus on its surface has these spike proteins, and the vaccines that we're currently using are only made using those little pieces of the virus that are on the outside. So the virus, in order to cause COVID-19, also needs the genetic material that's inside it, right? And it needs the entire structure to be inserted into a cell. All we are doing is we are inserting a little piece of the COVID-19 virus that then teaches the immune system how to recognize it, so that if you do encounter the real virus in the world, your immune system will say, oh, I've seen that before, I can deal with this, before it actually is able to take hold in your body and do damage. So that's how I like to think about the vaccines, is that they're sort of like the training grounds of your immune system to make sure that if you do meet the virus or the bacteria out there in the world, that the immune system will be ready to jump on it. And that's actually why many of the vaccines, you need 2 shots, because with the first shot, the immune system sort of says like, well, I can make a response to this, but I don't know that I should waste a lot of energy making a response to it because I may never see this again, right? And the second shot is the one that says, uh-oh, this is important. I need to be able to deal with it. And then it makes these very long-lived memory cells that remember this virus protein or this bacteria. So then when you do encounter it, it is ready to the immune system is ready to jump on it and to prevent it from taking hold.
Yes. Yeah. So you are training your body against COVID-19. You're not giving yourself COVID-19.
That's right.
Yes. So don't worry about it in that way. Just go get your shot. So let's kind of reinforce it for people. What are the benefits of going to get vaccinated?
So I think the benefit is that you can protect yourself from getting sick, or you can protect yourself from getting sick. And even if you don't have bad sequelae, bad consequences of the disease, you are preventing the spread to others who might, right? So it's your friend who's had a transplant that you're protecting, right? It's your grandfather, it's other people that are immunocompromised, it's the pregnant women. And I think it's really important to remember that pregnant women actually seem to be at a much higher risk for bad outcomes from COVID-19. We already give pregnant women specifically the pertussis vaccine, as well as the flu vaccine, because they are at much higher risk for poor outcomes from those 2 infections. And now also COVID-19 is specifically recommended for pregnant women to protect both them. And it turns out that when a pregnant woman makes antibodies, those antibodies also go to the baby, and it protects the baby during the first several months of life. So I think those are all the important reasons to get vaccinated.
That's a really interesting point, because folks are so concerned about the vaccine for pregnant women or for fertility and pregnancy and any stage of that, present or future, folks are concerned about it. But COVID-19, when you're pregnant, is serious. And that's really where the concern should be lying, and all the more reason to go get vaccinated. And then there was one more benefit, which is that we can stop all the variants from popping up.
Yes.
Mm-hmm. Yeah, we don't want this to get worse. Since the beginning, this has been like, we need to take precautions so things don't get worse. And so not just ourselves, very important that we protect ourselves, but that we protect other people too. So there's every reason in the world to go get vaccinated. Yeah. Yeah, well, thank you so much for being here with us, Dr. Wald. We really appreciate you. Dr. Wald is a physician and epidemiologist at the University of Washington. So thank you so much for being here again. We really appreciate it.
Thank you so much. If there are any follow-up questions, I'm happy to respond to them.
Yeah,
So just let me know.
Appreciate it. Yeah, if you have any questions, you can always get in contact with us here on CHW Radio, Los Regionales. It's been wonderful doing this series on vaccine myths. There's a lot of them. It's amazing how many there are once you start getting into it, and more pop up every single day. So misinformation and disinformation can spread like a virus, and we are responsible to stop it. So we need to do some stuff at a systemic level in terms of how information is sharing. Politicians, people with big megaphones out in the world need to be taking responsibility for what they're saying. A lot of politicians have been saying things that are inaccurate and untrue about COVID-19 and the vaccine, since the beginning for this past year and a half, and they've been doing a great public disservice and causing much death and sickness that was unnecessary. So we are all responsible for what we say. We're all responsible for whether or not we're sharing good information. Look up what you're talking about. Take some steps to ask where's the source for this? Where are you getting this information from? And just start vetting things. We can all be investigators, and we can all develop our own scientific literacy and start learning more about the science ourselves. And we all have that responsibility to stop the virus and stop the misinformation virus, which spreads just as quickly, unfortunately. Melissa Lazaro says, this information is very important to our community. Vaccinate is the way. Yes, vaccinating is the way. Thank you, Melissa. Aline says, thank you for this helpful information. It has been extremely helpful. Once again, a huge thank you to Dr. Wald of the University of Washington. And thank you all for listening. One more time, I'm going to remind you that we have this awesome program with Uber. So we paired up with Uber. We can get you a free ride to and from the vaccination site. Remember, benefits of getting vaccinated are that you can stop the potential of getting really, really sick from COVID and needing to go to the hospital or possibly dying, as spreading the illness to other people who could really have a bad effect from it. And they could be people that you love, people in your family, your friends. It's very important to protect yourself and others. And we need to be stopping the variants. The Delta variant is out because people have not been vaccinating, because people have not been taking COVID-19 precautions for all of this time. And we've allowed the virus to mutate. So do your part, go get vaccinated. You can contact Jacqueline if you speak English. It's 206-291-2599. She speaks English and Spanish. You can text or call her and get yourself a free ride. Remember to follow us on all of our social media. We are on Facebook, Community Health Worker Coalition for Migrants and Refugees. Just search us up there in the search bar. We're also on YouTube at Community Health Worker Coalition for Migrants and Refugees. You can also check out our website where we have live streaming 24/7, awesome music all day long at chwcoalition.org. And you can even listen to us on Alexa. All you have to do is tell Alexa, Los Regionales, CHW Radio. You can say that in English also, and you can open up our station on Alexa. We play wonderful, soul lifting music all day long. Thank you all again for being here. It's been an honor to share these good information with everyone so that you are better informed. Stay tuned.